Welcome to the Perfect Dose podcast. We dive into everything you need to know about skincare treatments, wellness tips, and skincare routines so you can look and feel your best. If this sounds like you, make sure you hit subscribe so you can stay up to date on the latest episodes. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. My med spa, The Perfect Dose, is located in Scottsdale, Arizona. If you are interested in becoming a patient and seeing me in practice, make sure you head straight to my website. If you're a medical provider and you want to stay up to date on the latest trends, techniques, have access to my protocols, articles, and business tips, make sure you follow me on Patreon at The Perfect Dose. For everyone else, follow me on Instagram and TikTok at The Perfect Dose. Hi everyone, welcome back to this week's episode. This episode, we are going to talk about sagging skin in the neck. What causes it and what you can do. This is something that I get asked about so much in my practice. I felt like I needed to do an entire video dedicated to the neck. It's oftentimes the most neglected area as well. We always remember to treat our face. We always seem to forget areas like neck, chest, and hands. So get ready for today's episode. If this is content that you love, make sure you like this video and hit subscribe. Before we get into what procedures really help treat sagging skin or crepey skin in the neck, I think it's really important that you guys understand what is happening underneath. I really want to break down the why of what you are seeing. So first thing that you're going to notice when you look in the mirror is texture changes. You may see that there is more sagging skin, that your skin doesn't look as firm, that it almost looks like a turkey neck. People call it turkey neck all the time, or they're like, I have just this laxity in this area that they just suddenly looked in the mirror and saw. And this is something that happens over time. It's not an immediate change. It just happens to be something that with time, it starts to look worse and worse. And that's because the skin in our neck is different than skin in other areas of our face. Our skin in this area is going to be more elastic. It's also going to be thinner. So we're going to see age-related changes a lot faster in this area than we do in areas like the cheek or the jawline. An area with similar skin texture is going to be like around the eyes. That's why we start noticing more fine lines, wrinkles under the eyes. We start noticing sagging skin. It's because the skin in these delicate areas is going to be more elastic, so more stretchy, and it's also going to be thinner, so it's more delicate. So when it comes to treating the neck, we also have to understand it's not just about skin elasticity and collagen changes. Those are the reasons why we see texture changes, but we also have to understand there's going to be muscle laxity that occurs, and there's also going to be fat loss. So really, it's the combination of the integrity of all three of these things that is really changing with age as to why we are going to see these changes in our neck. So we lose elastin, which is like that snapback feature. So if you notice certain areas or when you're younger, if you pinch them, they snap back really fast. That's because we have lots of elastin in our skin. Our collagen starts to change as well, and collagen really supports the skin. So think of it as the skin's foundation. It is going to provide firmness. It's a protein that really helps that structural integrity. So as we age, we lose elastin. We also lose collagen. Something else that happens is we lose hydration. And this is something that we really have to understand. Hydration is the core of anti-aging. So the more hydrated that our skin is, the more plump, youthful, supple that it feels. So our skin actually starts to change and become more dry, more textural. We lose that hyaluronic acid that keeps our skin naturally moisturized and plump. So we start to see more skin aging. Now, the other component is fat loss, and it's never the areas that we want to lose fat, you guys. It's always the areas that we don't want to lose fat that we actually start to lose fat. And then there's something called muscle laxity. And what that means is our muscle sits like tight on the bone in areas like the neck. It's something called the platysma muscle. And as we age, this muscle falls off the bone. That's why people talk about getting deep plane facelifts, because deep plane facelifts are going to literally put the muscle back where it belongs. So that's something that is going to happen as well with age. So when I talk about the neck and I'm talking about treatments, what I really mean is we need to throw the whole kitchen sink at the neck. And that's because we're losing structural integrity, we're having skin changes, muscle laxity, fat loss, a combination of things are happening The skin is more delicate, so you're gonna see changes more rapidly. Therefore, we're gonna have to be more aggressive with our treatments. It's gonna take multiple modalities. It's often going to take multiple sessions, and you really need to understand realistic expectations. Your neck may get a 50% improvement with these treatments. It may get an 80% improvement with these treatments. It may get a 20% change, really just depending on the severity of the laxity. So I wanna make sure you guys understand, if you're listening to this episode and you have severe laxity, you're going to need to consider a facelift. That is going to be number one. Now, I know not everybody wants a facelift, not everybody can afford a facelift, and not everybody needs a facelift, but it's something that needs to be talked about. Every single aesthetic medicine provider, like myself, needs to discuss with patients surgical and non-surgical options so we can make a treatment plan with realistic expectations. Now that you guys understand the why as to why we are seeing aging in the neck, I want to talk about what you can do. First, lifestyle changes. This may come as a surprise, but it's really important to maintain a stable weight. Now, I understand that things happen. There's pregnancy. I'm pregnant right now. So weight fluctuations are going to happen. Maybe you're on certain medications, certain stresses in your life, all of these things. So it may not be possible to maintain a stable weight at all times. But because the skin is very stretchy, it is going to be very sensitive to weight fluctuations. So if you are gaining a bunch of weight, losing a bunch of weight, that skin is going to stretch, contract. And over time, it's not going to go back to where it was. You're going to have more significant skin laxity. So it's very important to make sure we maintain a stable weight, eating healthy, exercising, all of these things, so that you can make sure to delay aging in the neck. So even though it's important to exercise to maintain weight loss, I want to mention that actually exercising your neck, like doing different stretches and muscle strengthening, is not going to help your neck. It's actually going to make it worse. And this is because of the platysma muscle. Remember that muscle that I talked about that starts to get lax as we age? This muscle, it's platysma, you can see me contracting right here. This is actually going to pull down the face. So if we strengthen this muscle, you're going to see the appearance of these bands much stronger, and it's going to make you look older. I see this a lot of times in patients that are runners, Pilates instructors, really heavy lifters. Sometimes they can't help but contract their neck. Not to say that you shouldn't exercise, because again, you have to exercise. I always try to make sure my neck is more relaxed when I do exercises so that I don't enhance and contract these muscles unnecessarily, strengthen them, and then increase the appearance of my bands, thus aging the face. The second lifestyle modification is sunscreen. And I know I say this all the time, you guys. It sounds so basic, but I'm telling you, every single person that comes to my office will literally put sunscreen all over their face, forget the neck, chest, and hands, and they have like 4 different shades going on. They'll have a really light face, really tan neck, really tan arms, and we just neglect this area. I don't know why, but UV damage breaks down collagen. So it's really important that we are not only putting SPF on our face, but we're remembering our neck and our chest. I literally take my sunscreen all the way down to my nipples. I'm not joking. I put it everywhere. I do it every day. And that's just in my basic skincare routine. That's not even when I'm going to be sitting outside. If I'm going to be outside, I'm reapplying every 2 to 3 hours, and I'm not neglecting those areas. Now, the other reason why SPF is important is not only preventative, but you're protecting your investment. If you're interested in getting neck procedures, it's important to understand we're throwing the kitchen sink. So it's not cheap and you need so many sessions. It's important that we protect that investment by applying our sunscreen. Now let's talk about skincare. I'm going to say something that might really surprise you, but you don't need specific neck treatments. Just like we're applying our sunscreen from our face all the way down to our nipples, you can do the same with your skincare. Ingredients that I recommend are the same that I recommend for the face. I always recommend a good retinoid. A retinoid is going to help promote cell turnover, so that's something that's super important. Think fresh new baby skin. If you're sensitive to retinoid, you're pregnant, or you're not going to apply sunscreen, make sure you switch to a pregnancy-safe retinoid alternative, which is called bakuchiol. It's going to be great for people that are sensitive to retinoids, or if you're somebody that isn't going to remember sunscreen in the summer, make sure you use a bakuchiol instead so that you don't burn. Using a retinoid can increase your risk of sunburn. The other ingredients that I love are growth factors, because those are going to stimulate 50% collagen, which is hugely impactful for your face, your neck, and your chest. I love a good vitamin C serum. That's the most cost-effective treatment just because it's an antioxidant. It has so many benefits. And if you're going to get one skincare ingredient, I definitely recommend getting vitamin C. Ultimately, consistency is key. So if you're not going to remember to bring your skincare from your face all the way down to your neck and your chest, then I would recommend getting a specific neck cream. Sometimes just for compliance, it's easier to have a neck cream on your table to actually remember. So if you're not going to be consistent with your other treatments, make sure you invest in a specific neck cream. I really love Neck and Correct by Skin Medica. It has some really great peptides that are awesome for hydrating the skin on your neck, for tightening the skin on your neck, and it's a way to remember to never forget or neglect your neck, especially when it comes to treating at home. The other skincare product that I recommend is going to be Red Light. I love a red light mask. Red light has so many freaking benefits, you guys. It's insane. It's something that you can do at home. There's no downtime. It's safe for everyone. I love the Omnilux mask because you can not only put it on your face, but you can actually lay it on your chest. Now, if you want to get really granular, I would invest in a specific neck and chest piece. It's called the Omnilux mask specifically for your neck and your chest. That way you can lay on your bed and literally treat your face, your neck, and your chest all at once. I will give you guys a discount code for Omnilux neck, chest, and face if you listen to the end of this episode. Red light really helps with inflammation. It helps with fine lines, wrinkles. It's something that you're not going to notice after one treatment, but if you do red light consistently 2 to 3 times a week, you will see a dramatic impact. I really like to think of this treatment as protecting your investment rather than something that you're going to get a big bang for your buck for immediately, like we talked about in my previous episode. If you want to listen to my episode that talks all about best value procedures so you can get the most bang for your buck, make sure you listen here. I will link it for you guys. Now that we've talked about aging in the neck, what causes it, what products I recommend that you use, lifestyle modifications, we can move on to in-office procedures. Now, the goal of in-office procedures is to stimulate collagen, and we're going to do that by either injecting it or traumatizing the skin. By traumatizing the skin, what I mean is causing physical injury or mechanical injury to force your body to stimulate collagen, or using procedures that combine heat with physical injury in order to stimulate even more collagen. Some of my favorite treatments for this area are going to be traditional microneedling, RF microneedling, which uses heat in addition to the microneedling in order to stimulate collagen and tighten the skin. I also love resurfacing lasers like the CO2 laser. If you're looking to address more of that crepey skin textural changes, how I would decide which skin tightening device to choose from is if you are, let's say, in your 20s or 30s and you're looking to be more proactive, preventative, or you have minimal laxity in your neck, you can get away with doing a microneedling session. Now, you're typically going to need anywhere from 3 to 4 sessions, but that is going to be least invasive. Next, if you really need to focus on tightening the skin underneath the neck, I'm going to recommend the radio frequency microneedling because the heat is going to be most impactful for skin tightening. And you also, depending on the depths that you're treated, can be getting some fat burning. So you don't want to burn fat in all areas of your face, but in some areas, like in the neck, specifically right underneath the chin, it could be beneficial. It's important to go to a very experienced provider because, again, the skin of the neck is very delicate. So we're going to want to treat the rest of the neck very superficially and light and not use a lot of heat. But in certain areas like the jawline and right under the chin, it may be impactful to crank up the heat a little bit and get some fat burning. Now, resurfacing is going to be really great if you have more moderate to severe fine lines, crepiness, or texture changes. I really love the Cool Peel laser, which is CO2, and that's going to basically ablate that first layer of your skin. Now, in my practice, I typically do combination treatments. I'm not just doing injectables. I'm not just doing laser. I usually do both. So when it comes to injectable treatments, I love a collagen stimulating filler. So it's not really a filler because the goal of filler is to volumize or add projection or structure. Really, the goal of a bio-stimulator is to force your body to stimulate its own natural collagen to thicken the skin, tighten the skin, and basically provide more collagen, firmness, and elasticity that was once there before, so you look younger and more refreshed. Now, collagen stimulators that I love are Radiesse. I typically will add more water to that treatment It's called hyperdilute radius. That way it's very thin and integrates with your tissue so easily. I also really love Sculptra. So depending on your provider and where you get treated, they may prefer one treatment over the other. For me in my practice, I prefer hyperdilute radius in the neck only because I feel like I get a little bit more volume. So I'm typically using hyperdilute radius in the neck and combining it with a skin tightening procedure in the same day. Depending on the severity of your skin laxity, the skin texture changes, we can choose either microneedling, RF microneedling, or a cool peel resurfacing laser. Now, I love biostimulators like Sculptra on the face. That's just my personal preference. I think that Sculptra provides an amazing outcome. It also helps regenerate bone. So I love injecting Sculptra in the face, and I typically use hyperdilute radius in the neck or the chest. Now, in addition to this combination treatment of injectable and skin tightening modality, I'm always going to recommend Botox in the lower face. And that's because there's that third component that we talked about, which is muscle. Now, if you have severe muscle laxity, this isn't going to make a significant impact for you. You're going to need surgery. But if you fall in the category of mild to moderate, which I would say about 75% of patients do, you're going to see a dramatic improvement by relaxing the platysma muscle. Like I said, that muscle is going to contract and really pull weight down on your face. So if you are going to get injected with any biostimulator or you're considering a laser, definitely start with Botox injections in the lower face. The FDA actually approved this indication for Botox Cosmetic with Allergan, which is really exciting because that means we have official clinical data that we can use to show patients the dramatic outcome that they can receive by getting injected in this area. On average, this is going to be anywhere from 36 to 40 units. So depending on where you go, cost for Botox is like 13 to 14 per unit. And I always recommend getting this treatment in addition to the upper face. I wouldn't just treat the lower face. I'm somebody that's holistic. I like to treat to complete and make sure everything matches. I hope you guys love this episode. Like I said, when it comes to treating the neck, it's important that we throw everything in the kitchen sink at it in order to get optimal outcomes. If you guys have tried any of these treatments or there's something that you tried and you loved that I didn't mention, make sure you spill the tea and leave it in the comment sections below.